Hey, welcome back to Caffeinated Conversations with Brooke Allen. This is our 113th show. I've been out in the world. If it seems like I've been disappearing, I've been moderating panels, making appearances at galas, trying to figure out what to wear, and meeting so many incredible people and organizations. It has been amazing. It's been kind of nonstop, of course, a little bit of filled with chaos, caffeine, of course, and a lot of connections. Well, Daisy is also sick today and last night, so I've actually been up all night with her. So that's making it a little bit challenging, and I've had, that kind of explains the hair, right? So that's what's going on today. So good morning, thank you again so much for being with us. I am super excited about this show because we are talking about two very important topics. It is Autism Acceptance Month, a time to listen, learn, and celebrate neurodiversity. It is also National Child Abuse Prevention Month. And the stats have changed, not in a good way. We will talk about those a little bit later. But right now, we are going to lean in with some energy, lots of caffeine, and of course, some gratitude to start our day. And I am so lucky today. I have got local celebrity. Sam Morris is here. He is 30, you're 34, right?
34.
All right, 34 years old. You are an artist, and you are out there, buddy, doing good things in the world. And I just love that. So thank you so much for joining us. And this is Sam's first podcast, so I am honored that you are here with me. So, okay, so first of all, you were diagnosed with autism at age 3.
Yes.
Okay, and and you graduated from West Bloomfield High School?
In 2011.
2011, how old are you again? No, just kidding.
30.
I know. Trust me, I am way older than you. Okay, so you are an artist. And tell me what you're wearing right now.
Right now, I'm wearing my shirt, Everyone is Value. And this is a way how to teach people that everyone can give and receive love because of recent hurtful comments of what was said about people with special needs.
Right.
And they need to learn from that, knowing how to take care of themselves.
Mm-hmm. Yeah, because people were saying that people with neurodiversity or autism, that they're not able to take care of themselves, hold down a job, or even date, right? And that's not true, right?
Right.
Okay, so I mean, obviously you have a job, you're an artist, and you designed this to kind of dispel the myths out there.
And to spread love in the world.
Right, right. So how did this design come to be? I love it.
This design came to be when last year in the spring, there were hurtful comments of people with disabilities that hurt in my feelings, which made me in the need to create these shirts this past summer. And I also worked on different designs, looked up different colorings.
Is blue your favorite color?
Paper drawings.
Okay.
Blue actually represents someone from the sky and someone catching hearts from there.
Oh, I love that. I love that a lot. So is that little boy supposed to be you? Would it be you?
Yeah, I'm spreading the love.
Yeah, I love it. I love it.
By catching hearts from the sky.
Right? So you have been involved with the Friendship Circle, right?
Since I've been involved in that program since 1994.
Is that when it started, I think?
Yes.
Okay.
And I was the first one there.
That's amazing. Okay, so tell me a little bit about the Friendship Circle. I know that I can be on the road and
Friendship Circle
the
is
stickers.
About it's a nonprofit organization and wonderful program that involves special needs people doing activities and
socializing,
doing all that. 11 years ago, Friendship Circle got me into Soul Studio, which is like an art program.
Yes, I've heard about that.
And it got me into one of the practice drawings, and it helped me to know how to spread love in the world in the way of such a very loving person and teaching how people need to support others.
For sure. Have you always been an artist? I mean, since you were little?
For 11 years,
Okay. All right. So 11 years you've been drawing, and this is not your first. This is not your first go around with shirts and mugs and everything, right? Because after the insurrection, you came up with Heartshine.
Heartshine.
Tell me about that.
The January 6th Capitol riots was horrifying, and it was very, very terrible, and with all people and spreading hate in our country when the windows had weapons and cracks all over. They were shattered, and the mob inside the U.S. Capitol that made me in the need to write something about Heartshine, which is about the light, the rays of the sun penetrating through a heart, as how love can be shown by light penetrating through broken windows into the nation, how love needed to be spread worldwide because many people were so upset when the Capitol was attacked. So then $10,000 have been raised to the Anti-Defamation League.
Right, because your other design was
all
sold.
the shirts in every state in the U.S.
That is amazing. That is such an amazing thing that you've done. So with these shirts, everyone has value. Absolutely love it. So where do these donations go to?
The Arc of America.
Okay, and so for people who may not know what the ARC is, can you tell me a little bit about that? Putting you on the spot, aren't I? I know so they are nationwide, right? And there's one in Oakland County.
I know.
Okay, and that, but the money that you raise from these shirts will be donated to the ARC? Or to the Friendship Circle?
I'm raising money for the ARC.
For the ARC, okay. So I've seen you in papers, I've seen Karen's post about you and everything, so I know you're making the rounds. You've won an award. Tell me about the award you won.
The award I won was Everyone Has Value, like selling shirts and mugs and blankets, and people I know or who don't know, giving them to themselves, family, or friends.
Right, what a great gift, right? I have...
very loving to me.
You are a very loving person. So are you an only child? Do you have brothers and sisters?
Yes.
Okay. Do you make them buy these? You should.
The people have been buying them. And the money has been raised and collected.
That's wonderful. And who prints these for you? I'm trying to think, is there
At the Winning Imprints, the person who works at the store, her name is Emma Zirkle.
Okay, yes. So I've spoken to Emma on the phone before, but we've actually never connected. But I heard she's amazing. So they do the printing for you, correct?
They do.
That's awesome. That is wonderful. So how long did it take you to design this?
It took me for about a little under 6 months.
Okay. And so my guy is wearing a yellow shirt, right? So I love those. So how much do these sell for?
Hundreds and hundreds of dollars.
Really? All right. Well, I'm going to have to refinance my house, Sam. Thanks, man. No, this is wonderful. And of course, you got to my heart because you actually have a travel mug. So I'm all about that, right? So it's...
Yeah, my brother got one of them, and then he gave them to me to take to this podcast today.
Oh, really? Nice. So you have the travel mugs, you have a blanket, you have the shirts, and I think online I even saw like a onesie for a baby, right?
Onesie,
Yeah.
yes.
Yeah. So, and you know what? I thought that is amazing to put a baby in a onesie that says everyone has value, because you're starting off perfect, right? That baby will grow up knowing that just by wearing your shirt that you designed. So, if you had one thing you wanted somebody to know about you, what would it be?
That I was diagnosed with autism at the age of 3.
Okay. And how, when you were out in public, how do people treat you? Are they nice?
Yeah, they're very nice.
Good. Good. I'm glad. But have you ever run into somebody who was a little bit rude ever, or?
Seldomly.
Good. Good. Because I know people are not nice sometimes, right? Which is why you created these shirts.
Yes, I have.
Is there a website that people can find these on?
www.winningimprints@chipley.com.
Okay, and we will put that up as well. Okay, so this has been your first podcast. What do you think? Thumbs up or thumbs down?
Exciting.
We did okay?
We're doing awesome.
Awesome. Thank you so much. Well, listen, I appreciate you so much being here and what you do. And do you have another project in the works? Like another shirt you might be nope, not yet?
Nope.
Okay. All right. Well, guess what? I'm one of your biggest fans, and I'm going to get 2 of these shirts for my kids so they can wear it and spread the word and spread the love, because it's so important.
Well, 9 years ago at the Soul Studio, I've done Sweet Hugs, and it's done through Friendship Circle.
Okay. And I know Friendship Circle has a huge event, don't they, every year? And I assume that you're always there,
Yes,
right?
and we do Walk for Friendships
Yes.
annually.
Okay. So and if I end up going to that next year, you'll be there, right?
For sure.
Okay, awesome. Thank you so much. What a pleasure. Seriously, thank you for joining me, and it's just fantastic what you're doing. And we will make sure that the word gets out about these shirts because it is for such a good cause, and it has been such a pleasure to meet you. Thank you so much.
You're welcome.
I appreciate it. Well, I have loved our conversation, and Sam, thank you for your honesty, your creativity.
Yeah, so nice to meet you.
It's so nice to meet you. And, everyone has value, so I think this is the lesson of today, and maybe this week as well. I know that this conversation will stay with me, and I hope it will for our audience. So now I want to take a quick moment to spotlight someone who supports this show. Of course, it's Dr. Saul Kogan, the founder of the Nerve and Disc Institute. You've heard me say what a great guy he is, but he is also a great doctor. We all know that living in pain affects your quality of life with a groundbreaking procedure called intradisc neutrosis. Try saying that 5 times fast. Whether you're suffering from sciatica, spinal stenosis, or a herniated or bulging disc, the Nerve and Disc Institute takes a non-surgical and holistic approach. And we've actually been able to hang out at his office, meet a few of his patients who say he is a lifesaver when it comes to restoring mobility and getting rid of pain. Let's watch.
I'm Kim Owens, and I'm from Clarkston, Michigan. I had a back surgery, a laminectomy. I have spinal stenosis in my neck and lower back. Even after that, I was in constant pain. The doctor told me that, and I specifically asked this because I'm very active, he told me that I could do everything that I used to do, no problem. And I soon found out that as soon as I started trying to do those things, I would get severe pain. And it just gradually continued to get worse to the point where it didn't require any sort of physical activity, and I was just in constant pain. So I had gone to another surgeon that I was recommended to, and he had told me that I needed a full fusion and that it would take at least 4 months for that to heal with a skin graft and all sorts of metal before I could even start physical therapy. And that was not appealing to me whatsoever. Plus, anyone that I know that has had a fusion has had just very bad luck with it. I've even had other doctors tell me do not have a fusion. So I was at my wit's end. My husband and I were in the car when we heard Dr. Kogan's commercial. And he said, I'd like you to try that. And I was concerned sitting in the meeting because he said he only took patients that he thought he could help. And I thought, what if he doesn't help me? So gratefully enough, Cliff and I both came here for treatment. So I've been treated for my back, for my neck, and for my knees, my knee pain. I had some pain prior to from a ski accident, but I could live with that. But with my back, it just proceeded to get continually worse. So I started doing all 3 treatments. What I appreciated most is that I could do them all in one appointment. I didn't have to come several different times or days. I can honestly say that I feel so much better. I'm golfing, I'm skiing. I can now go out and dance again, where I couldn't do any of those things that I loved. And so I feel totally blessed. The interdisc treatment, which is what this is very gentle. Most days when I come in here, I actually take a nap when I'm doing my back and my neck. It's not like my knees are I'm sitting up, but they're all very gentle. They target those specific areas where you're having issues, and it really does help regenerate your discs. The Knee Restore RX is a great treatment as well. You're actually sitting up for this with your leg extended. They do the treatment with laser, as well as a machine that helps gradually stretch that area again to allow the nutrients in your own system to rehabilitate those areas that are sore. I walk out of here feeling no pain or very minimal if, it might be my first treatment, but it's amazing. The other piece I like about it is if you do have a hiccup along the way, maybe you've overextended yourself or what have you, and you do have pain, they do have a program where you can come back in and just get 1, maybe 2, 3 treatments, whatever you need. Dr. Kogan, I think, is amazing. He's very patient. He's a good listener. You meet with him throughout your treatment so that he can check in with you and find out what your progress is, and will adjust your treatment accordingly. The staff, I can't say enough good about the staff. My husband and I both have busy schedules like most people that come here. We have changes that we have to make to our appointments. They are always accommodating. I never feel like I'm inconveniencing them. When you do come on your appointments, they're very happy to see you. They're very knowledgeable about setting up the equipment and making sure that you are taken care of and everything's comfortable for you. And any questions you have, they are happy to help and answer them. I felt like my whole life changed because I've always been very active. Then I was limited to what I could actually do. And it was, in a sense, depressing for me. I didn't feel like I could do the things that I love to do. And then on top of it, I'm not getting the exercise and getting that energy out of me that I need to. And it was just frustrating. And I did not want to have to live my life that way. So this to me was truly a saving grace. I am extremely grateful. I feel like I am so much better off now after having come here than I would have been otherwise.
I'm Nerve and Disc Institute. They have locations in Clinton Township, Farmington, Grand Blanc, and Bad Axe, and you can book your free consult online at nervediscinstitute.com. And if you mention Caffeinated Conversations with Brooke Allen, you'll get 50% off your treatment plan. Dr. Kogan and his team, they are dedicated to helping people find real relief and get back to living their lives without pain. And I'm so grateful for all of his support here at Caffeinated Conversations. Well, when we talk about value, we're also talking about protecting that value, especially when it comes to our children. And April is also a National Child Abuse Prevention Month. Awareness is important, but real impact happens when communities, organizations, and individuals come together and collaborate. And Billy Ragland, you are here. You are the Director of Community Education at Care House of Oakland County. And a lot of people don't even know what Care House is.
Sure.
So let's start by that.
Yeah. Care House is a child advocacy center. We provide 3 types of services, basically prevention, which is workshops and stuff for children, which we'll talk a little bit more about, I believe. We provide forensic interviewing for children who have been, when there's an allegation of child sexual abuse, severe physical abuse or neglect, witness to violence, and human trafficking. We provide forensic interviews for children. We work with law enforcement, child protective services, foster care, to coordinate that service for children. And then we also provide a court orientation for children who are going to be going to court to testify. And we provide therapy for children, families, and siblings, because child abuse affects the whole family usually. And we also have the CASA program, which is court-appointed special advocates for children who are in foster care.
Okay, so I mean, so many programs, and yet a lot of people don't know about Care House. Sometimes I wonder if that's, because of the forensic interviews and everything, it is kind of kept on the down low a little bit, right? As far as some of the things.
That's true. A lot of people who come to us are coming to us in a rough time of their life, in a time of maybe chaos or crisis. So we don't, thankfully most people aren't sexually abused. So we don't have a lot of foot traffic in that way.
Right.
And then a lot of the service that we provide, like prevention services, are often in coordination with other places. So you may have received Care House services or been the beneficiary of them in some way, but never
knew it,
knowledge or
right?
information. Right.
Like, what? So I lost my train of thought for just a second. But so the numbers, I know COVID really brought it out, right? As far as it was, okay, well, everyone's at home and we kept hearing about everything on the rise. But the stats are not good now.
No, they aren't. When I first started at Care House 15 years ago, the statistic that we used mostly was 1 in 10 children will be sexually abused before they turn 18. But now we say 1 in 5 children will be sexually abused before they turn 18. Sexually abused or sextorted or abused through the internet in some way.
Okay. Because, abuse happens, like you just mentioned, online, in person. It can happen anywhere, anytime.
Sure.
And when we talk about kids, what ages are we talking about?
That we provide prevention services?
Yeah.
Sure. We have a couple of different programs that are fun for kids. They mostly start preschool age, but they go all the way through high school.
Right.
And then we're working on some specific services for teenagers, but right now we're focusing on preschool and elementary school children. We have a child safety fair that we do. And we explore child safety topics like body safety through some fun carnival games and stuff like that.
I actually have been to one of those, and it was really interesting to see the kids interact and the red flags and the sand, and they're playing, but they're learning. And what's so interesting, and you and I have talked before, is that sometimes they don't realize what they're learning until later.
This is true, yeah. When most people hear sexual abuse prevention education, they think that we're going to be talking about sex and body parts and stuff like that, but that's not really what we talk about. Most of what we talk about is manipulation, and healthy relationships, healthy behaviors, how to spot red flags, which is very different than what you provide through sex education and other stuff like that.
And even like safe person, right?
Yep. Yeah. So the safety fair helps open those conversations to community organizations and to children and parents together so that they can see that it's not a scary topic. It's not necessarily uncomfortable to talk about, and there are a lot of conversations that you can have a lot of times that can prevent your child from experiencing sexual abuse, but really any kind of abuse, because the way that adults manipulate children into abuse is the way that adults manipulate other adults.
Other adults, right?
Right. So it's just kind of setting a foundation for those kind of healthy behaviors and practices.
Right, and if they learn young, then they realize as they get older if someone is trying to manipulate them, right? So it kind of stays with them. So it's interesting because the one thing that you would think of is that people would welcome this kind of education, and it's not so easy sometimes.
It's not so easy sometimes, especially now. Anything really regarding children's bodies, or it sounds like regarding children's bodies, is kind of like a minefield. So there's that kind of barrier there. Schools have a barrier of time and availability also, because they're already providing services all day long and don't necessarily have a lot of room for other things. There are also other options for prevention education that they can use. And in general, because most people have never received body safety or prevention education to learn about bodily autonomy or secrets versus surprises or anything like that, they're kind of resistance to its need, possibly.
Okay, so what about, so as the kids get older, I know it has to change, right? I mean, like the education, and because they're facing different issues.
Right.
And it's even, you guys even talk about relationships.
Yep.
As far as dating with teenagers, right?
Yeah, sure. Yeah, because those healthy behaviors and healthy relationships are going to occur with throughout your life. While we can use bigger words and talk about more complex subjects, the red flags you're looking for as a teenager are just the same as they are for a child. There's someone who violates your boundaries. There's someone who isolates you from other people. There's someone who I can't think of another example. Could be someone who is doing a lot of gift giving to you and stuff like that.
Right.
So those are the same things that adults do to little kids, and those are the same things that teenagers do to each other.
That's amazing to think of it like that,
Yeah.
right? It's like, oh, so you have been at Care House, what, 15 years? And I know that you've been trudging out there, like just trying to get this out there in different ways. And you are big into collaboration. So
Yeah.
what else is going on? Tell me.
Yeah, so let's see. Community engagement kind of suffered a lot during COVID, especially among professionals and organizations who do this kind of work together. There was a giant staff turnover with a great exit, I think they called it.
Right.
So that occurred in the nonprofit area as well. So some personal relationships, and ways of coordinating services really no longer existed. The people that we want to speak to the most are children, of course. And I was receiving a lot of support and engagement from my board members and community people, and everyone that hears about our services always says, "Oh, you should try to get this in the schools. You should try to get this in schools." I'm on my deathbed, and the nurse is gonna say, "You should try to get this in schools." Oh my gosh, sorry. We try. So after a number of strategies that didn't fully pan out, I ended up getting a meeting of other prevention organizations together to figure out what people were actually doing. I wanted to see what cities kids were receiving services in, so we could try and focus in other ways, and see how other people were dealing with meeting the need of working with children without possibly using the schools.
Right.
And then it turned out nobody really was. We were all actually having the exact same problem, like little tastes of success here and there, but no one was really in the schools, and no one was really providing very consistent services to groups on a regular basis. It was kind of like single serve stuff. So not only were we able to share the safety fair idea with people,
Right.
but in a subsequent conversation where you were invited to the meeting,
I was.
someone at the meeting had a really good idea of trying to turn some of these concepts and ideas into a play or skits that children and teenagers, and really anyone of any age, would be able to see and use, so that we could continue to provide services to families and children directly, but not necessarily rely on schools to do it.
Right, for sure. So it is, and it's like theater, right? It touches everyone at different points. And like we said at the beginning, with kids, when they're at that safety fair, they don't really know what they're learning. So when you're watching a show, you're like, oh, I love that show. And then you start thinking about it.
Right.
And then you go back to it, and then you're like, oh, you know what? That seems familiar, or I recognize that, or sure, right?
Yeah, and what we experience, just like as people who do presentations to little kids and to teenagers, when you tell children that it's okay to tell and that you actually should tell,
Right.
they do every time. We get
Yeah,
disclosures all the time, whether it's preschoolers or children who are in their senior year of high school, every time. And the same thing when we train adults in mandated reporter training or signs and symptoms, we also receive information from adults.
So
then
it works.
It works.
It works, right? It just has to get out there more and in a bigger way, I guess. So mandated reporters, I think that there's kind of a myth about that, right? Because can anybody become a mandated reporter, or?
Anybody can report child abuse and neglect.
Okay.
Mandated reporters are people who are required by law to report, and I believe there are 35 or 37 different professions.
Okay, so it's not like somebody could say, oh, you know what, I'm gonna become a mandated. You have to have like one of those.
It's not a, it's less of a certification than just a general status.
Okay.
So anyone can take mandated reporter training, and anyone can report child sexual abuse.
Okay.
Some people are required to do it by law.
Right, because of the
That's
job.
it, right, right.
Okay. So,
So we try to talk to mandated reporters and people who aren't mandated to report because everybody has their eyes on children.
right, for sure. And you could have, as an adult, you could have like a suspicion that something seems off, right?
Right.
So if an adult did have that suspicion, who do they call?
They would call Child Protective Services. There's also, they would call Child Protective Services. That would be the best bet.
And I know that they were completely swamped. You know, we had story after story when I was still at Jay, and it was, you know, they're so overwhelmed right now. And I don't know if that's still bogged down or if it's gotten better.
Yeah, you know, I think individual offices don't necessarily have a lot of control over their own staffing. I can say from my experience, the people that we work with are wonderful and hardworking individuals.
for sure.
But it does seem that if there were more people, they would be better supported to do their work
Right.
there. But our we have a good relationship with Child Protective Services throughout all of our programs. And
Okay, so if anyone suspects a child is being abused, they can call CPS directly.
they can call CPS.
And it's anonymous.
It's anonymous.
Is it always? Or?
Yeah, it's anonymous. For mandated reporters, you have to disclose your identity, but that information isn't shared with parents or families.
Or whoever you're.
Right, right, whoever you're calling about.
Okay.
What did you ask?
Let me think. so the mandated, because I wanted to get some.
Oh, yeah. Okay. People, if you really wanted to, you could also call Care House, and would more than likely be put through to one of our crisis counselors to see if you needed immediate assistance, because it could relate. You know, someone could be coming in after this phone call or whatever. So we can provide that support too, but also, you know, Department of Human Services is always available.
Okay, so it seems like it takes a very special person to work in this industry.
I think, sure. However, it's actually really fun. Everybody has fun. Children are happy to be at Care House typically, even though it's a rough time in their life. Even when they come for forensic interviews, a lot of times when they walk out the door, they say stuff like, I hope, when can we come back? I hope we can come back. So being part of that is extremely rewarding and a blessing that I would have never imagined that I would be part of as an adult. So
what did you want to be when you grew up?
I'll tell you two funny things. The first thing I wanted to be was a priest because I thought you didn't have to go to college. And then I wanted to be a chef because I thought you didn't have to go to college.
Really? Yeah. So did you go to college?
I did. A lot.
I was going to say, I think you went to college a lot, didn't you?
I did.
Oh my gosh, that is so funny.
So I ended up being a social worker.
Okay, so any regrets?
Oh, no. Oh, no.
And I mean, you've been at Care House for
15 years, yep. I started as the manager of a home visiting program. So we see families once a week for 90 minutes for the first 3 years of their child's life.
Okay.
Do parent education, community stuff, family goal setting, stuff like that. So I did that program for a long time and then transferred up to this education program.
So if somebody, I think we know that if somebody has suffered abuse as a child, sometimes they don't always recognize that or remember even.
Sure.
Right? Sure. So we're talking about kids, but for an adult out there who may need some help, who would they call?
Well, no, this is not true. You can always refer to the 1-800 number on the back of your insurance card. I know, but that's not what people are looking for. I would, if it were me, I would contact Oakland Community Health Network.
Okay.
Which I don't know the phone number, honestly.
I put you on the spot. It's okay.
Just switched. It just switched from Common Ground to that switch. So they could call the 988 number, which is for suicide prevention, but they could also provide resources for people who are hurting or need help. Okay, or the 1-800 number for Common Ground, or not. Excuse me, I can't remember what it is.
It must connect still if it's.
I think the number is identical.
Okay.
I just don't remember what it is.
Okay. No, and I put you on the spot with that, but it just was a thought that it's kind of like, well, sometimes people don't realize this, and it suddenly hits them, or they need help, or they know somebody else who needs help.
Yeah, that's definitely true. We talk to teenagers a lot about that. Maybe not necessarily, here's what you do, but here's what you do if you have a friend who you know is in trouble.
Right. And that's important. Okay. Well, Billy, thank you so much. It's always a pleasure to see you. I'm looking forward to future collaborations. And that's one thing that when you were the one who called everyone to this meeting, that says a lot, because you're like, okay, well, we can do this in a bigger chunk if we all pitch in rather than, collaborate rather than compete.
Right.
Right?
Yep.
Seems to be the key.
It is. There's plenty of work to go around. There's not plenty of money to support it. So we have to kind of all stick together and make sure that we can get as many children in contact with the information as possible.
Okay. And as far as churches, there's anyone can reach out, right? And ask for a presentation.
Anyone.
Okay.
Yeah. We could even do, at your apartment complex's community room, anywhere like that. At library, we'll go almost anywhere.
Okay. All right. Awesome. Thank you. Thank you so much for the work you do. And it's invaluable. And thank you for joining us. I appreciate it.
All right.
All right. Well, that is it. We talked about two very important topics today. Sam, our local celebrity. Billy, thank you so much. And it is always such a pleasure to be back with you again. It is May. We've got a couple more things happening. Wednesday, I will be at 1 Million Cups. They are doing a markers marketing. I always get confused with that, but that starts at 9 o'clock at 1 Million Cups. That's happening in Ferndale. Also, my mom, she is having surgery this week. So right after I'm done, I'm seeing that on Wednesday. I'll be meeting her at the hospital. No, she is not taking an Uber. She'll be just fine. But we are probably going to be hit or miss a couple times, and we're going to the Mackinac Policy Conference. So that's exciting as well. So a lot of stuff coming up. Again, you can always check out helloimbrooke.com, see what's going on and see what's happening. Again, I appreciate all of you sticking with us. This has been show 113. Thank you so much for joining us. Big thank you to M1 and to everybody. And like I always say, keep the coffee hot, because you never know what the temperature is going to be here in Michigan. Thanks so much. Have a good week, and I'll talk to you soon. Thank you. Bye-bye. And time for